Well, the name of my company is Biomarketing Insight, and I'm a new product planning slash strategic commercial consultant. And basically, although I specialize in the life science, although it's not exclusively, I cover pharma, biotech, medical device, diagnostic, and the healthcare industry. And what I try to do is help to de-risk the product development process by bringing commercialization into product development to make it more successful. And that is really trying to define what they call the target product profile to make sure that it is successful in the market. Just to give you a little bit of background, the reason why we need to do those things is because for a company to bring a product to market, on average in terms of the industry for pharma and biotech, it takes 10 to 15 years.
Wow.
And
a lot of capital.
A lot of capital. So the capital, on average, in terms of the industry bringing it to market, is $2.6 billion, and that's with a B.
Wow.
30 years ago, to show you the difference, it may have been 800 million. But because, and we were talking about this earlier, we're going from chemistry, which a chemical reaction happens the same way, so it's very predictable. And that's what they call small molecule. But now they have actually, because there's only so many pathways in terms of chemistry, they've actually advanced on to what they call large molecule or biologics, which is the biology. And that is very, very complex.
So it's much less predictable in a sense.
It's much less predictable. You're going to spend a lot more money in terms of really understanding the biology of diseases.
So, and this may be a little bit off topic, but is that where we get movement towards companies working together, associations trying to bring people together to work on solving some of these issues because of the complexity? And if you have, I understand the commercial aspect of it. Everybody wants to get across the finish line,
Sure.
But by the same token, if you have, half a dozen companies working on the same problem, you're not really gaining the value of sharing information.
Well, I think the problem really becomes is understanding the diseases. And I think that's where the industry is trying to come together and actually sharing information. Now, in order for a company to be successful, obviously you need the science and you need the business, but a company actually relies on the intellectual property. If you don't have intellectual property, you really don't have a company. And so people have sort of, hold their information close to them because, again, your IP is very important. But I think the industry has learned that in order for our industry to actually move ahead farther than what we've been doing so far, we really need to understand diseases. So we need to collaborate, say, with the academic people. We need to collaborate with the industry people who will do that translation from the research, the basic research, into translating that into diseases. And they're trying to, right now, because yes, you do need your intellectual property, which everyone, tries to patent. But it has to be a point where it's what they call pre-competitive. So if you can bring everyone's idea together and collaborate, that just brings you forward. And then your particular IP, which is the innovation part of it, that is really more the interpretation of all the basic research and everything else that brings them to a solution to a problem.